Hi everyone, this is Jazz. If this is the first time you're watching one of my videos, this is my journey through breast cancer. This is my second video, and this is to share with you how my first week of chemo went. My chemo was on Monday the 21st of September, and today is exactly a week later. It's the 28th of September. On the day of chemo itself, I went to the hospital and I sat down in my chair. They put a cannula into my hand, which was expected. My nurse had talked me through the entire process, so I sort of knew what to expect. I think the first shock to my system was when the nurse came over with her visor on, and she was all in PPE, bless her. She was so lovely. She had a big tray in front of her with, I think there were about 8 large syringes of medication that she had to pump inside me. So that was a bit of a scary thought, but yeah, she did it, and I got through it. It didn't take as long as I expected it to be honest. Some nurses apparently put the medication through an IV, so it's going through into your system via the tubes. My nurse actually sat with me and applied her own manual pressure to pump the medication into me. So bless her, she sat with me through the entire time and talked to me the entire time, which kept me distracted. It was absolutely fine. I felt very comfortable throughout the entire process. I will just suggest some tips, as I've learned from that day that there are certain things I should think about. First of all, because I had the cannula in my hand, I definitely needed to go to the ladies during the treatment, and I had to. I'm just so glad I was wearing something with an elasticated band, because I could only use my one hand to pull up and down my trousers. But had I been wearing jeans or something, it might have actually hurt my hand and my cannula. So just have a think about what you're wearing when you are going in for your first treatment. Also, another tip is to eat light. I think before my first chemo session, my amazing family wanted to see me, obviously, and they wanted to, treat me and stuff. So I'd been fed very well, should I say. And yeah, I think I felt the aftermath of it. So I wish I'd had eaten a lot lighter than I had. So just bear that in mind. Another tip I would say is to try and relax. I think I was quite tense during my treatment while she was injecting my hand, and since my treatment I've just been in quite a lot of muscular pain down my neck and my shoulder and my back and my head, to be honest. So yeah, the more you relax during the session, it probably would alleviate some of the pain that you may feel afterwards. And one last tip, take a pen and paper with you, because after my first chemo session I was given a multitude of medication and injections to take over the course of the first 7 days after the chemo. So trying to remember when to take which medicine, at what time, before and after food. It was a lot to take in, so take pen and paper and you will easily be able to remember that way. Because chemo brain is a real thing, and there's been lots of things I've sort of remembered and not remembered because my head has been all over the place. So after chemo on my first day, I came back home. For 2 hours I felt fine. I actually spoke to some of my family and some of my friends. But after 2 hours, I had to lie in bed. I felt really uncomfortable. And then the hot sweats came out and I started shaking. And the next minute, I'm sweating and I'm running to the bathroom constantly. I felt nauseous, but I wasn't sick. But everything came out the other way. So my body was in a bit of shock from the treatment. The nurses did say to me that if there is a major side effect like the one I was having, then to call through to A&E. So I did do, and my partner, bless him, took me to A&E that evening, and I was there for quite some time, which you would expect in accident and emergencies. But they basically gave me some paracetamol for the pain that I was in, the discomfort that I was in, and they said to me that these were the expected side effects of chemo, and that maybe the next time I go for chemo I could ask for additional, antibiotics or pain relief. So that was that. I ended up coming away, but luckily they said I wasn't dehydrated, and that's the most important thing. You need to keep drinking water. You need to keep hydrated, because trust me, everything is going on in your mouth throughout the entire few days after chemo. Even still to this day, it still is. Okay, so first day was quite a shock to the system. Few days after that, I felt very nauseous, but I wasn't sick. I'm so pleased. I just wasn't sick, but my stomach was upset. My taste buds have gone really funny. Nothing tastes the same. I'm hungry and I know I need to eat, so I'm forcing myself to eat. So some of the amazing food my family and my partner's mum has made for me, I'll share with you, because it's really what has kept me going and given me a bit of strength. Being Indian, my mum made me proteh, which, if you know what that is a stuffed chapati. It's a stuffed bread, and oh my god, I think they were the first proper things I ate after chemo, because all I was craving was a bit of spice and a bit of juiciness and a bit of taste, because all you can taste is a metallic feeling in your throat, and it's very unpleasant. A few people that I've spoken to have said that it's a bit similar to when a lady is pregnant, you get your taste bud goes very funny. So it's similar in a sense. So that's something to be prepared for. And I would definitely say try different things, because you just don't know which one will work. But Mum's proteh were the best thing. And then my partner's mum, bless her, she made me some spicy soup, which was absolutely delicious. And I really wanted to finish it all, but I couldn't eat it all, and it was so yummy. But that spice, that taste, that flavour, that is just what I was craving. So I was so grateful that I've had lovely people around me to make me some food. So throughout the days, I've been pretty much in bed most of the time. I've barely spent any time with my partner. I'm sure he sometimes feels like he's living alone. But I've had amazing support from my family, my friends. People have been messaging me and trying to ring me, but because I've been so out of it, lack of energy, I've just not been able to respond. So I do apologise for that, but I'm trying my best to get round to everybody, because everybody means a lot to me. You'll see behind my balloons, they're still there from last week. It was my 40th birthday on the 1st of September, and my amazing family threw me a beautiful afternoon tea party in the back garden, in my mum's back garden, and I was just so overwhelmed. But it's memories like that that keep me going through this process. It's to see how much love and affection I've had, and how much support I've had from my family and my partner and his family, to be honest, that has just really kept me encouraged and kept me going. Because I know they're all rooting for me, and I know they're going through every step of this with me as well, and I'm really grateful for that. Some of the other things I might suggest are think about what you want to eat. My mouth, my palate has been a major problem for me. So my boyfriend, bless him, has been out on several occasions, hopping to the shops to get me this and get me that, get me Lucozade, get me jelly babies, get me fruit, get me bread, anything that I can put in my mouth. But yeah, I have got to honestly say, every time I've taken a tablet, I've had a jelly baby straight after it, because it's just so nice. It just makes my mouth feel so good. On day 5 was the first day I actually had a shower. My boyfriend was like, I think you should try and get in the shower. Obviously he wasn't being rude, but I'm sure I did smell, I just couldn't smell it on myself. But I went in and had a shower. It was a very quick one because I couldn't survive in there for that long. But I'm so glad that I had that shower on day 5, because before then I just did not have the energy to get out of bed or to even step into the shower or anything. So I'm really grateful that he encouraged me to do that. He's been great on various other occasions. On day 6, I woke up in the morning with a very, very sore throat, and I barely slept because I felt like I couldn't swallow. It was really painful. And when I got up in the morning, he was obviously working from home, and I just said to him, can you just check my throat? It really hurts. And as I opened my mouth, he was like, babe, your tongue has gone white. It's gone wrong. It looks really white. And I was like, what? And I didn't even look at my tongue. I looked straight at my throat when I looked in the mirror. So that freaked us out a little bit. And bless him, he insisted that we go to A&E again. And I'm glad he did, because I have a mouth infection. Yay! And on top of the mouth infection, I have small signs of tonsillitis. You know, you just think, oh, can I deal with any more after all the, low energy over the last few days? But I'm so glad he insisted, because they obviously gave me antibiotics, and they've given me some drops to put on my mouth, on my tongue, which don't taste great. But yeah, as long as they work, that's the key. So yeah, it's been an interesting week, and today is obviously day 8. And I'm feeling a little bit better, which is why I'm doing the video. It's been a hard week. It's given me the heads up as to what to expect over the next few months. But yeah, it's tiring. Just be prepared to be in bed a lot. Everybody will feel different symptoms, I'm sure, and do you know, all I've been thinking is, my God, the women or the people, should I say, who have been through chemo in the past, my God, hats off to you all, because it is a hard fight. And without your loved ones, without people around you giving you support, it's just hard to get through it. So I'm rooting for each and every one of you, whether you're suffering yourself or whether you're a carer of a patient. I'm rooting for you all. You can get through this. We can beat this. It will not defeat us. So I'm going to leave you there. Please, if you feel you have any questions, drop a comment underneath. But thank you very much for watching again. And no doubt you'll see another video of me soon. Bye.